I'm Lisa McCrea. I'm a registered massage therapist, graduating from Sutherland Chan School in Toronto in 1988, and I graduated from the Guild for Structural Integration in 1995. The Rolf method of structural integration has been the focus of my work since that time. I'm here with Kevin Lucas from Structural Innovations in Spokane, Washington. Kevin is here with us in London, Ontario, doing a 500-hour training of the Rolf method of structural integration. We're very fortunate to have him here. It's unusual to have the training in Canada at all, so for him to travel here to train the therapists here is an amazing opportunity. And I've asked him some general questions in order to offer some more information about the Rolf method of structural integration. Kevin, what is the Rolf method of structural integration?
The Rolf method of structural integration, the technical definition, is a 10-session process that reorganizes the body in the field of gravity. A lot of times people are kind of confused by what that means, and so what I like to tell my clients or educate my students to educate the public is structural integration, particularly the Rolf method of structural integration, is a form of manual therapy that really looks at addressing the problems of the structure and not just treating the symptoms.
And what makes the Rolf method of structural integration different from other manual therapies that are out there?
The biggest thing that makes the Rolf method of structural integration different than just about any other form of manual therapy out there is 3 keys. The first key is that we are looking at the body as a whole. What a lot of people don't understand, or what's happening in today's Western medicine culture, is that there's a lot of what's called spot treatment. So if a patient comes in and says, my shoulder hurts, the really great physical therapist or the really great massage therapist, a chiropractor or a doctor will look just at that spot, and they'll try to adjust or be able to treat the symptoms for that particular spot. But then oftentimes, a few months later, those exact same symptoms come back because they're not looking at the whole structure. They're not looking at how the shoulder is related to the neck, or looking at the shoulder, how it's related to the spine. And so the biggest premise of the Rolf method of structural integration is that we're looking at really trying to create big picture, long-term change and efficiency within the structure by addressing all of the body's pieces and parts together so we can facilitate that long-term change. We accomplish this, which is coming to the second piece of what makes structural integration very different than most other manual therapies, which is we're working with the fascial system. Fascial tissue, or the word fascia, is really the hot buzz in a lot of runners' journals. A lot of physiotherapists or massage therapists are talking about it. And what the fascial tissue is that if you imagine that we had a package of spaghetti, and each spaghetti noodle was a muscle cell, that group of muscle cells are surrounded by a piece of plastic, and that plastic is what organizes that group of muscle cells together. So what happens when that fascial tissue is overused, underused, or injured is that fascial tissue, it actually starts to shrink and it starts to become very sticky, making it very difficult for all of the body's pieces and parts to do what they're supposed to, which is the muscles are supposed to contract or relax. Your nervous system is supposed to be able to move neurological flow through it. Your veins and your arteries or your lymph is supposed to be able to move that fluid through those tubes. And when that fascial tissue starts to shrink, it prevents the body from being able to do that like it's supposed to. So the third piece that really makes this work very different than a lot of other things that are out there is how we teach our clients how to be able to use their body more efficiently. So there's a lot of people that talk about posture, there's a lot of people that talk about moving more efficiently, but very rarely do those people connect all of the pieces and parts of the body together. So for example, someone might be talking about posture and they'll just talk about bringing the shoulders back. Well, if your hips are tilted forward or if your hips are crooked, it's going to be very difficult for you to bring your shoulders back comfortably and easily without then causing other compensatory issues.
Is it lasting?
People are spending a huge amount of time and money getting treatment. They're getting really great chiro, physio, massage therapy, but what a lot of people are reporting is that their symptoms are coming back. And if every week they don't get their massage, or if every week or twice a week they're not getting their adjustments, those symptoms are coming back. Well, what we've found through tons of clinical research and our practitioners sharing their chart notes is that the clients are reporting they're getting significant long-term change that is actually lasting. So the Rolf method is a 10-session process, and in the beginning that can sound like that's a lot to commit to, but when you compare it to a lot of other treatment protocols that require someone to come in 3 times a week for a month or 2 months, it's really a small number in the big picture. And as a result of having that long-lasting result, after we're done with the initial 10 series, most people only end up needing to come back for what we call tune-up work once, twice, maybe 3 times a year.
What kind of training does a Rolf method practitioner require to be able to do this work?
This is a really, really great question. What we're seeing throughout the United States and Canada is that there's a lot of people saying that they're teaching structural integration or that they've taken a structural integration training. So there's a lot of questions about, well, how do I find an approved school, or what schools do I look at going to? And what we encourage our prospective students to do is that we want them to go to the International Association of Structural Integrators website, and there's a list of approved schools, and there's 22 schools that are on that list. And what we encourage our clients to do, or potential students, is that to look and shop between these schools. It's a 500-hour training minimum of structural integration. And what's happening is that there's some people that are teaching what they're saying is structural integration in 4 two-day workshops versus a training that's 500 hours. That's a very significant difference in the information they learn. It's a very different in regards to the practitioner's ability to recognize structural patterns and compensations, learning how to read the body, which is how our profession works, is that we watch someone walk, we watch them sit, we watch them lay down, we watch them go through all of these basic functions so we can see which muscles and fascial planes are working well and have the correct range of motion, which ones are too short and too tight, which are actually maybe causing the problem but is creating the symptoms someplace else. You know, for example, if that pelvis is rotated forward or tilted forward into an anterior tilt position, that can really kick the neck and the shoulders forward, but the patient doesn't experience the pain in their hips, they're experiencing the pain, the symptom in their neck. And so you can do all the amazing neck work that you want, but until that pelvis becomes more level, that head and the neck never have the opportunity to come to their more structurally ideal position.
So how does someone find a practitioner?
Finding an approved provider or approved practitioner is very, very important. And again, you can go to the International Association of Structural Integrators website. Many of the schools that are approved, which my school, Structural Innovations, is recognized and approved by IASI, they also have practitioner lists that you can click on, find a practitioner, and they'll provide you with the name and information of someone from that standpoint.
What can someone expect when they go for treatment?
We get this question a lot from our clients when they call in and they say, what can I expect? I've had PT, I've had massage, I've had chiro, I've had surgery, I've been on medications. How is this going to be different than anything else that I've done? Well, one of the things that we're going to do is most structural integrators will sit down and do a very detailed intake with you. They're actually going to sit down and talk to you about what it is that you have going on. You're not going to just get some giant list of check boxes that you have to check off that someone might peruse through or might not. This is really important in the detective process of being able to really discover maybe what's contributing to your symptoms and your problems, as opposed to just addressing the symptoms. So when someone gets to sit down with you and talk with you in detail about what you have going on, this provides the opportunity for change. Another thing that's a very effective process that we put into play is just like chiropractors will take x-rays, or if you go into the doctor and they'll do a CT scan, most structural integrators actually use before and after pictures to be able to assess your structure, and then we take them before and after each session to be able to chart. We put you in front of a grid that has horizontal and vertical lines, and we can measure your height and see which shoulder is higher and if your body's rotated. And as we do that, you're able to see, because a lot of times people don't realize how bad their bodies really are, or how tilted or rotated or crooked things are. They think they're just great. And then we compare that before picture to after 2, after 3, after 4, and then after 10. It's mind-blowing. People literally break down into tears seeing the profound difference of where they started from and where they go to. When it comes to actually receiving the work is very interesting because it's its own thing. It's not massage therapy, it's not chiropractic care, it's its own specialty. And what I like to tell people is that you're going to be on the table, your practitioner is going to be having you do simple ranges of motion. So let's say if a structural integrator might be working on my arm or my rib cage, and they might have me do simple motions with my arm. While they're working my neck, they might have me look one way or look the other. If they're working my leg or my hip, they might have my leg go through a particular motion while they're working with that tissue. So the structural integrator is using their hands, they're using their forearms to be able to get in contact with your tissue, to be able to move the tissue in the direction that it needs to go. It's really a fascinating thing because there's really nothing else that's like it. One of the big things that I would warn people about is that if you're seeing a structural integrator where the work is always painful while you're receiving it, that's a big indicator that you're probably not going to be able to get a lot of long-term change or get change that's long-lasting. Again, it should never hurt. There's times where you're working where the work can be a little bit sore or a little bit tender as we get into an area that's restricted or that's tight or stuck. And as we work that tissue, again, the difference between how we teach our students, the difference between pain or soreness is that if I'm working and you have to hold your breath or you have to get away from what I'm doing, that's your brain saying that tissue damage is happening and that something is going on that it doesn't want to go on, and it's going to cause everything to shorten. Now, if I'm working with someone and they can feel that it's starting to get a little sore, but they can still stay relaxed while I'm working, whether it's their arm, their rib, their neck, whatever, that's the difference between something that's tender and sore and painful. So being able to always be in a position where you're communicating with your structural integrator about whether it's uncomfortable or not is a big key on making structural integration very successful, and some of the things that you can look towards in your session. Over 60 years of development, Dr. Rolf found that there was an order in which the body needed to be worked. And when we work the body in that order, we get more change, and the changes are longer lasting. It's very similar to building a house, is that if I have the roofers show up before there's framework, I don't have anything to put a roof on. Or if I put framework on the ground without putting a foundation down, that framework is gonna get eroded and destroyed by the ground and the moisture and the wetness and anything, all the critters that come in and connect with all of those pieces. And so the 10 series is very similar. Each session is a recipe that we're following that organizes the body. It starts to free things a certain way, much like if we were peeling an orange or peeling an onion, or if I had a glass figurine that was inside of a present, inside of a present, inside of a present. A lot of manual therapists really just get in and start doing a lot of very aggressive and firm or hard manual therapy. Well, by the time they've beat up those boxes, they get to that glass figurine and it's broken. With structural integration, what we're doing is that we're unwrapping one box, we're pulling that out, we're unwrapping the next box, and we're working our way from the outside to the inside in a way that's comfortable and manageable. And then this allows us to be able to organize the structure in a very systematic process. And this is really the key that allows or it facilitates the successful results that we get out of structural integration.
Can you tell me how the Rolf method can benefit hockey players?
How structural integration can have a direct impact immediately for you as a hockey player is a lot of the positions that you get stuck in when you're skating, your hip flexors end up being really tight and really short, and so that can cause a lot of issues in your hips and your legs not being able to move like they're supposed to. So there can be groin pulls, there could be low back pain, there's knee pain, all from those hips being too tight. Structural integration's ability to be able to lengthen those cables that are too short and to bring balance to the cables that are too long will have a direct impact on your skating.
And what about dancers?
Oh my goodness, dancers. You can actually find quite a few articles and research articles about structural integration and dancing specifically. One of my teachers, Andy Crow, actually worked with the San Francisco Ballet Company for many, many years, directly working with this very high-level dance company. Dancers are, in my opinion, pound for pound, dancers and martial artists are the greatest athletes on the planet. They are doing things that most other athletes are never capable of doing physiologically. physiologically, and they have to do them for extended time periods, and they have to do them in repetitions that are over and over and over. So a dancer, what we find with our dancers is that, again, injury recovery and injury prevention, the other thing that happens is that they become more fluid, they become more efficient, their rotations, their turns become more organized, or they become more tight, their leaps and their bounds become much more high and long. Everything just improves. Anybody can benefit from the Rolf method of structural integration. It would be like saying what yard wouldn't benefit from water, right? It really, there's no limitation on who we can work with. My practice is specialized the last 16 years in working with two main demographics. The first one is I've worked with the worst of the worst, the worst diseases, the worst traumas, helicopter accident victims, Parkinson's, post-polio, muscular dystrophy, the list really goes on and on and on. The other side to that, the other demographic that I work on or work with are elite level athletes. I have the very fortunate opportunity to be on the medical team for Gonzaga University, which is one of the US's top basketball programs in the entire country. And I've been working with that program for 8 years now. And what we found is that the athletes that we work with in an immediate emergency state recover from their injury at an exponential rate compared to without using structural integration. What the athletic department has found, as well as the other Olympians and professional athletes that we work with that live in our city, is that the recovery rate is much faster if they do have an issue or an injury. Their recovery rates from their basic workouts are exponentially improved, meaning that they can get back to training sooner with less injuries, and it prevents injuries like nothing else. One of the things that the athletic department at Gonzaga has found is that their athletes overall, the amount of ACL tears, the amount of hamstring tears, the amount of repetitive injuries in the hips or the shoulder, our baseball players, the sport doesn't matter, the athlete doesn't matter. It provides huge, profound results. And the reason that this is because your body is becoming so much more efficient, because in the world of sports, it's all about efficiency, power, and speed. And the longer the lever arm, or the longer and more efficient your legs and your arms and your spine can be, that translates into you being able to be stronger, faster, and then your ability to recover is exponentially increased.
Can you tell me a little bit about your school?
I would love to tell you about my school. My school's name is called Structural Innovations, and it is one of the 22 recognized schools by the International Association of Structural Integrators. It's a 500-hour program that's been approved by this organization that is sharing the method, or is approved to be able to teach Dr. Rolf's method of structural integration. There's 22 different schools. One of the things that sets my school apart is that, or is different, is that we travel to different cities. So my school is a 500-hour program, and how we operate is that we do 1 week a month for 15 months, which really gives me an opportunity to provide people who wouldn't be able to go get this training the very amazing opportunity to learn structural integration. So right now, we're in London, Ontario. We're 10 months through our 15-month program, and it's really a very, very effective method in regards to... Very amazing. It is a very amazing process to be able to help healthcare providers. Most of my students are either registered massage therapists or physiotherapists that are looking to be able to help their clients kind of move to that next level. So Structural Innovations, I started it in 2006, and so we're going on our 8th year, right? Is that the right math? 2006, we started teaching our first class, and we've been having a class or two about every year. And now that we're doing our training in a 15-month protocol, it's really allowed us the opportunity to travel to some really amazing places and meet some amazing students.
Kevin, can you tell me about your Relief Through Rolling program?
My passion in life is to teach people to fish. I believe we're living in a day and age right now where so many people are giving away their power in the healthcare system, meaning that they think that, you know, the doctor or the therapist or myself is the one who's going to be able to fix them. And what really happens is that when, as a healthcare provider, when we can educate our patients on what they can do to take care of themselves first, that's the difference between being truly healthy and happy and being at the mercy of the medical medical system. So one of the things that I've created, my background as a structural integrator, is that a lot of my clients were always asking, how can I do this to myself, or what are things that I could do to help support what we've accomplished in the 10 series. And one of my clients about 10 years ago brought in what's called a foam roller, which we're seeing in gyms all over the place, physiotherapist offices, massage therapist offices. We're seeing them in journals and magazines, and they're really starting to blow up. And what I found was that a lot of people who are working with a foam roller actually stop using the foam roller because it's painful. And the other piece to the foam roller that may make it not as successful as what it could be is that there's particular patterns that our muscles and our fascial tissue need to be put into so they can function properly. Very similar to if your car is out of alignment and the wheels are out of alignment and the tire wears out and you just keep replacing the tire as opposed to fixing the alignment, you're never going to have those long-term results. So I created a foam roller program that, number one, is pain-free, which means that people are going to be more apt to do it. And the thing with pain is that if you're experiencing pain while you're doing anything, it's scientifically proven that your nervous system actually contracts and it shortens. So if you're getting a massage or you're getting structural integration or you're working with any healthcare provider and you're in pain while it's happening, your tissues actually shorten to protect. And the same thing was happening with the foam roller. So we created a method of foam rolling that's pain-free. In addition to that, I've been able to replicate many of the techniques or the way that we as the healthcare providers work with the body, so the clients can do that with the Rolf method of structural integration, and how they can replicate many of those same techniques on the foam roller, which is one of the big pieces that helps support their 10 series.